Welcome viewers. In my previous video, I had talked about the anatomy and histology of female breast. In this video, I will continue with some of the salient points related with breast anatomy and histology and then discuss about one of the very important topics, that is lymphatic drainage of breast. One has to be well versed with the lymph flow of breast if he or she wants to understand the dynamics of spread of breast cancer, that is the most common cancer in females worldwide.
In this view, you can see the cut open section of the right female breast. At the front of the chest, the breast tissue can extend from the clavicle or the collarbone to the middle of the sternum or the breastbone. At the sides of the chest, the breast tissue can extend into the axilla. Now you are able to see the nipple. The nipple is surrounded by a pigmented circular region of skin called the areola. The areola shows small punctual elevations on its surface. These are mostly sweat and sebaceous glands as well as modified mammary glands called areolar glands of Montgomery. In this view, you can see the subcutaneous fat as a flap-like tissue. The base of each breast is attached to the chest by the deep fossa over the pectoralis major. The space between the breast and pectoralis major muscle is called retromammary space. As you can see also, there is one more fossa superficial to the fossa covering the superficial surface of pectoralis major muscle. This is the superficial fossa of the breast. Now deeper down, you can see the cut section of the belly of the pectoralis major muscle. Deeper to it, the chest wall composed of ribs and intercostal muscles are seen. As you see here, the female breast extend on average from the level of second rib to the level of sixth rib in front of the rib cage. Now I am focusing the posterior aspect of anterolateral chest wall related to the breast. Here you see the concerned ribs with their respective intercostal spaces labeled in detail. This is the superior view of the cross section of chest wall with first intercostal muscle, pectoralis major muscle, its fossa called the deep fossa of breast, the superficial fossa of the breast, the fatty tissue layer, and lastly skin from deep to superficial aspect respectively. In this front view, you can see the structures revealed after removing the outer half of the right breast deep up to the level of pectoralis major fossa. You can now see the pectoralis minor muscle which lies deeper to pectoralis major muscle. Now I will discuss about the fossas of the breast. As you see here, the fossas covering the superficial surface of pectoralis major muscle labeled as the deep fossa of breast. Also you can see the superficial fossa which on bifurcation forms the fascial planes of the breast. The anterior lamella of this superficial fossa is seen here, following the contour and skin of the breast, while the posterior lamellae extends inferiorly along the deeper extent of the breast covering the pectoralis fossa. Here you see the anterior lamellae enclosing the breast tissue till nipple as a 3D cone with its base formed by the posterior lamellae. Here you can see both the fascial lamellae of the breast nicely revealed to clear your concept of the fascial planes. The fossas continue inferiorly as scarpas and Campas fossa. The histology of the breast will be discussed now. The connective tissue of the breast is present at two locations, intralobular and interlobular stroma. The interlobular stroma is seen here, which appears more fatty as appreciated by the yellow color. In this view, you can see both the types of stroma. The interlobular stroma separates one lobule from the other and is composed mainly of adipose tissue and some loose connective tissue. The intralobular stroma encloses each lobule and its acini and ducts and is chiefly made of loose connective tissue. The interlobular tissue around the glands is more fatty and around the duct it's more fibrous. You can appreciate the more fibrous nature of the interlobular stroma now. Now focusing on the glandular component of the breast. The glandular tissue includes the lactiferous lobes and ducts which drain out through the nipple. Each breast has 15 to 20 such sections which are separated by fibrous bands. Each of these lobes has many smaller structures called lobules. The lobules are all linked by thin tubes called ducts. Now you can see one such lobule with its basic unit called the terminal duct lobular unit, in short TDLU, which produce the fatty breast milk. The secretory portion of the TDLU or terminal duct lobular unit is the lobular acinus, which drain in terminal duct. That's why the name terminal duct lobular unit. Many terminal ducts unite to form segmental duct, which further unite to form collecting duct, and so on to form lactiferous duct, lactiferous sinus, and ultimately draining out of the nipple as 15 to 20 outlets. Each breast also contains blood vessels and vessels that carry lymph. The lymph vessels lead to small bean-shaped organs called lymph nodes.
Before going into the details, I would like to give a brief introduction about what is meant by lymphatic vessels and lymph node. Lymphatic vessel is a unidirectional low pressure network of vessels that run parallel to blood vessels and are found in all regions of the body except the central nervous system and bone marrow. Though most of the blood exchanged in a capillary network re-enters venous circulation, about 10% is extruded into the interstitial space or tissues. This fluid must be returned to the blood circulation to maintain fluid balance. Small-sized lymphatic vessels called lymphatic capillaries contain a single-layer endothelium with loose junctions in the basement membrane that facilitate re-entry of that extruded fluid as lymphatic fluid. Lymphatic capillaries drain into pre-collectors which sequentially drain into collecting vessels and ultimately into lymph nodes, which are solid packed tissue with immune cells consisting of lymphocytes, plasma cells, macrophages, and a host of cells, all sharing a common function of immune defense of the body. Lymph nodes themselves have lymphatic vessels draining away fluid from them called efferent vessels, which join similar efferent vessels from other nodes to drain into larger vessels and regional lymphatic trunks, which then finally return back the fluid to veins and thus the volume of blood is maintained. Having covered the introductory aspects of lymphatic drainage in general, I will now move to the specific topic of lymphatic drainage of breast. This topic has been divided into 3 segments. In the first segment, I will talk about the lymphatic vessels. In the second, the lymph nodes. And lastly, in the third segment, about the pathways of drainage or flow of lymph through these lymphatic vessels and nodes. So, coming to the lymphatic vessels first, the lymphatic vessels of breast can be categorized into superficial and deep lymphatic vessels. The breast originates from ectodermal tissue, thus, its lymphatic drainage is mostly parallel to the lymph flow of the overlying skin. Lymphatic flow from the skin finds its way to the diffuse subcutaneous plexus between the skin and the superficial fossa. This superficial lymphatics of the breast drain along a subdermal plane into the axillae, typically collecting in a single sentinel lymph node at the lateral border of the pectoralis major muscle. The superficial lymphatics of the nipple and areola, which connect in a dense network of pre-collectors known as the subareolar plexus of Sappi, as seen here. This plexus is interconnected with the deep lymphatics vessels of the breast. The deep lymphatics, as seen here, drain the breast parenchyma originating in the interlobular tissue and within the walls of the lactiferous ducts. The deep lymphatics then pierce the deeper fossas, pectoralis, and intercostal muscles to drain into the axillary and internal mammary nodes. Now, as I have told previously, I will be speaking about the second segment of breast cancer lymphatic drainage, that is the lymph nodes. Talking about overall drainage of lymph flow of breast, whether from superficial or deep regions, about 75 to 90% of the overall breast lymphatic flow drains into the ipsilateral or same side axillary group of nodes. The parasternal or internal mammary nodes come second in the drainage flow from the breast. They receive 10 to 25% of the breast's lymph, which is mostly from deep lymphatics, while approximately 5% of the breast lymph flow goes into the posterior intercostal nodes. There are other nodes which also need to be mentioned as they come as intermediate nodes when lymph flows from the previously mentioned nodes to finally drain into veins. I will speak of them as soon as we come across them in the animation. It is worthwhile to mention here that lymphatic channels originating from one breast may cross the midline and terminate nodes associated with the contralateral breast. Now I will be speaking in detail about the axillary lymph nodes or chain, which receives a major lymphatic drainage share for the breast, thus making it the most commonly involved node in spread of cancer breast. The upper outer and part of the lower outer quadrants drain primarily into these axillary nodes. Here, I would like to add that although the axillary nodes drain most of the breast, there is drainage region is not confirmed to the breast alone. Each one of the axillary node group, according to their location, drain other regions of the body besides the breast. I would be speaking about that when I discuss each of these nodes as they come in view in this video. The axillary lymph node chain may be divided into 6 groups, namely anterior or pectoral nodes, posterior or subcapsular nodes, lateral or branchial nodes, central axillary nodes, interpectoral group or Rotter's nodes, and finally the apical axillary nodes. The apical nodes are the final common pathway for all of the other axillary lymph nodes. Here you can see the anterior axillary nodes, also known as the pectoral or external mammary group. They contain 5 to 6 nodes along the lateral thoracic vessels at the inferior border of the pectoralis minor. They receive drainage from the lateral aspect of the breast and abdominal wall and drain into the central group. Coming to the posterior or subcapsular axillary nodes, also known as the subcapsular group, they consist of 5 to 7 nodes on the lateral edge of the scapula, anterior to the subcapsularis muscle. They receive drainage from the lateral aspect of the breast, the posterior neck, shoulder, and the trunk. Now, you see the lateral or branchial axillary nodes, also known as the axillary vein or humeral group. They consist of 4 to 6 nodes medial and posterior to the axillary vein and receive the majority of drainage from the upper extremity and drains into the apical axillary group. The central axillary node seen here lies deep to the pectoralis minor muscle within the adipose tissue of the axilla. They contain about 4 to 5 nodes and receive drainage from the breast through the above mentioned lateral, anterior, and posterior axillary lymph node groups. Now you see the apical axillary nodes, also known as the subclavicular group. They contain 8 to 12 nodes between the superior border of the pectoralis minor muscle and the clavicle, lateral to the first rib. This group receives drainage from all other levels of axillary nodes and drains into the subclavian trunk, which flows into the thoracic duct on the left and the right lymphatic trunk on the right side of the body. Infraclavicular nodes is seen now, also known as deltopectoral nodes, while not part of the axillary chain, lie in the region bordered by the clavicle, deltoid, and pectoralis major muscle. Surrounding the cephalic vein, this group receives drainage from the superficial lymph vessels of the lateral side of the hand, forearm, and arm. Now you are able to visualize the supraclavicular nodes, which receives the breast lymphatics through the apical group of axillary nodes. The supraclavicular lymph nodes are a group of between 4 to 12 nodes located superior to the clavicle. The supraclavicular nodes form a component of the terminal pathway of the lymphatic system as it joins the venous system. More specifically, the right supraclavicular lymph nodes drain the breast, lung, and upper esophagus, while one of the left supraclavicular lymph nodes, Virchow node, receives lymphatic fluid from the thoracic duct, abdominal cavity, and thorax. Afterward, the supraclavicular lymph nodes located on the right side, as is also seen here, drain into the subclavian trunk, which joins the jugular trunk to form the right lymphatic trunk, while lymph nodes located on the left side drain into the thoracic duct. Furthermore, the left and right breasts, although symmetrical, have different terminal lymph drainage points. The right breast drains into the right jugulo-subclavian junction, while the left breast lymphatics drain via the thoracic duct to the left subclavian vein. Moving now to medial or inner side of the right breast, you can see the parasternal nodes, which receive approximately 10 to 25% of breast lymph. Also known as the internal mammary nodes, these nodes travel along the internal thoracic artery and vein within the intercostal spaces and deep to the parietal pleura. Perforating lymphatics accompany perforating branches of the internal thoracic artery through the deep fossa and pectoralis muscles. These nodes are, as seen, are a group of 4 to 5 nodes residing at the anterior limit of the intercostal space adjacent to the thoracic arteries. The parasternal nodes drain both the inner and outer half of the breast, primarily in the inner quadrants and the lower outer quadrant. You can see the drainage of inner half of the breast towards the parasternal nodes. Now, moving superiorly and laterally, you can see the drainage of outer or lateral half of the breast towards the paraternal nodes. The parasternal nodes subsequently drains to the superior and inferior epigastric lymph pathways to the groin. A small portion of the lymphatic flow also goes to the subdiaphragmatic and subperitoneal lymph plexus. Now, in this view, you can see the deep lymphatics emerging through the pectoralis major after having pierced it along with associated blood vessels. These deep lymph vessels then pierce the CP fossa to drain into the apical group of axillary lymph nodes. In this view, you can also see the interpectoral nodes. Also known as Rotter's nodes, they consist of 1 to 4 nodes between pectoralis major and minor muscles and receive lymph drainage directly from the breast, draining into the apical axillary group. The interpectoral nodes are not part of the axillary node group. If one talks about the lymphatic drainage of breast and does not mention the surgical levels of lymph node important for surgical operation of breast carcinoma, it would make the whole topic incomplete. Lymph nodes draining the breast are categorized into 3 levels depending upon their anatomical relation to pectoralis minor muscle. Level 1. Lymph nodes lie below the lower edge of the pectoralis minor muscle. As you can see here, the anterior, posterior and lateral nodes are the level 1 nodes. Level 2. Lymph nodes lie underneath, posterior to the pectoralis minor muscle. It includes the central axillary and interpectoral nodes. Here you can see the central node lying deeper to the pectoralis minor muscle. The interpectoral node has been shown earlier lying between the two pectoralis muscles. Level 3. Lymph nodes lie above or medial the pectoralis minor muscle. You can very well see that apical node lies above the pectoralis minor muscle. Here you can visualize the supraclavicular node as well above the pectoralis minor muscle. I will now talk about the third or the last segment of the topic of lymphatic drainage of breast, that is the pathways of lymphatic drainage along vessels and nodes. There are 3 important pathways of lymph drainage of breast. The axillary or lateral pathway. As already told, it is the dominant pathway which receives 75% of lymph from breast. It also drains lateral quadrants of breast either directly by superficial lymphatics or via Sapi's plexus by deep lymphatics to axillary nodes. This pathway runs around inferior border of pectoralis major to reach the anterior or pectoral group of lymph nodes or pass directly to the posterior subcapsular group. The anterior, posterior, and lateral axillary nodes drain into the central group, which ends up in apical group of axillary nodes. Few channels from the superior breast to the apical group are sometimes interrupted by the infraclavicular or deltopectoral nodes. Internal mammary pathway. It originates from both the medial inner and outer lateral quadrants of the breast. It passes through the intercostal spaces and pectoralis major into parasternal or internal mammary lymph nodes. They are interconnected across the median plane with contralateral breast intermammary nodes. Retromammary pathway. It comes from the deeper portion of the breast and it passes through the pectoralis major, then pierces clavipectoral fossa into apical group of nodes. Some drainage to the posterior intercostal lymph nodes near the rib head through the cutaneous branch of the intercostal vessels and then to the thoracic duct. Other pathways occur when usual channels are blocked in disease. Lymph may pass through the contralateral breast, cervical nodes, peritoneal cavity and liver through the diaphragm or through the rectus sheath.
Thank you all. Please do like, subscribe and share my videos.